All right, welcome back. In this video, we're going to be looking at the relationship between the tibia and the fibula here in the lower leg. Here's the fibula, and we can see how it attaches at the head into the tibia and down here into the talus, as well into the tibia here at the malleolus. There should be some movement in this bone, especially with ankle flexion. When the ankle flexes, there should be just a slight rotation that occurs in the fibula itself. For this to occur, there needs to be some freedom of movement between these two bones. Ida Rolf, who founded Rolfing and Rolf Structural Integration, used to say, free the fibula. And what she was mostly interested in was a piece of very tough fascia between the two bones called the interosseous membrane. Interosseous means between, osseous means bone, so between bone membrane. Ida Rolf used to work with the superficial fascia here on the shin in order to get deeper into, or get in effect deeper into the interosseous. In Chinese medicine, the interosseous here is along what's called the stomach meridian. Basically runs right along its length, and acupressure points are basically going right down the interosseous. I think it's always good to note commonalities and correlations, especially with Chinese medicine, but any other modality as well. We're going to release into the interosseous membrane by unwinding, which is what's called an indirect method. A direct method would be to directly come in here and try to lengthen the interosseous by lengthening the tissue, directly working the tissue to get length in it. The indirect approach is going to be quite a bit different. We're instead going to compress the fibula into the tibia, which is going to compress the interosseous membrane. And as we do so, we're actually going to shorten this tissue. But as we shorten it, we're also going to be increasing the fluid pressure within the membrane itself. And then we're going to be manipulating that fluid pressure to help soften the membrane from the inside out. Okay, so here we are with a live model, and the first thing we're going to notice is my positioning. And my legs are comfortably under the table. I'm using an electric table, which makes that a lot easier. My hands and arms are going to be fairly close to my body, and that's going to keep me in a sort of relaxed, strain-free position. So the first thing I do is come in and do some assessment. For landmarks, here's our tibia here. Our fibula is here, and you can feel the head of the fibula. It's that protrusion up on the lateral side below the knee, and then the bottom, the distal end of the fibula is the malleolus here at the ankle. So I want to feel some movement and rotation in the fibula with ankle flexion and dorsiflexion, and I can feel that here down at the ankle. I'm also going to come up and try to feel it here at the head of the fibula below the knee, and both feel pretty good to me. But you're going to want to check for that sort of thing. Then I'm going to come in and I'm going to just gently compress the fibula into the tibia, which is going to compress the interosseous membrane. And I really just want to feel for where it's the thickest or the least forgiving. And if it's something that feels even, then just go ahead and work evenly. If it's something that feels like, oh yeah, it's definitely more restricted here, then this is where you want to focus your work. So for application of technique, all I'm going to do is compress the fibula into the tibia, and I can do that a number of ways. Here I'm going to come in with a hand under and then a hand on top. And I'm very gently going to squeeze my hands together, gently but firmly. You're going to squeeze until you feel kind of a point of easy resistance, and that's where you're going to hold your pressure. And I'm just going to hold my pressure for a while until I feel some movement between the bones, and then I'm just going to follow that movement. And again, it's going to look, something like this, but even more subtle. And my palms are engaging the bone. They're of course engaging, they're feeling the superficial fascia, they're feeling everything on top, but I want to maintain that engagement into the bone. And just feel for the little dance in between. And I'm going to come in again down here at the ankle, where to me it feels a little bit thicker and a little bit more dense is right through here. So. Okay, and again, there's some other various ways to do it. You can come in like this and do the same type of motion, same type of unwinding. Either way, the goal is the same. We're going to basically be using fluid pressure. We're going to compress the fibula into the tibia, and we're going to be shortening the membrane. And as we shorten, we're going to be increasing the fluid pressure in the membrane, which we are then going to use to open up that membrane from the inside out.